Greetings from DC. This is Jennifer Lee, Director for Environmental Health and Health and Disability at NACCHO, the National Association of County and City Health Officials. Welcome to an overview of the Voluntary National Retail Food Regulatory Program Standards Mentorship Program. The mentorship program has been made possible through a cooperative agreement between the Food and Drug Administration, FDA, and NACCHO. It is part of a 5-year initiative to strengthen the role of local health departments and promote effective city and county regulatory programs responsible for retail food protection in the United States. The cooperative agreement has 4 specific aims. The first one is focused on increasing local health department awareness and adoption of food safety regulation tools, resources, and practice. The second specific aim is focused on strengthening local health department involvement in food safety regulation. The third specific aim is focused on improving FDA's, NACCHO's, and local health departments' knowledge of the connections between the retail program standards and public health accreditation as guided by the Public Health Accreditation Board. And the last specific aim is focused on improving NACCHO's and FDA's understanding of the effectiveness of retail food establishment inspection, scoring, and grading systems. The mentorship program primarily focuses especially on aims 1 and 2 of the cooperative agreement. The retail program standards serve as a guide to regulatory retail food program managers in the design and management of a retail food regulatory program, provides a means of recognition for those programs that meet these standards, and establishes any additional requirements to meet individual program needs. When applied in the intended manner, the retail program standards should identify program areas where an agency can have the greatest impact on retail food safety, promote wider application of effective risk factor intervention strategies, assist in identifying program areas most in need of additional attention, provide information needed to justify maintenance or increase in program budgets, lead to innovations in program implementation and administration, and finally, to improve industry and consumer confidence in food protection programs by enhancing uniformity within and between regulatory agencies. The retail program standards are comprised of 9 standards, which include the following: regulatory foundation, trained regulatory staff, inspection program based on the HACCP principles, uniform inspection program, foodborne illness and food defense, preparedness and response, compliance and enforcement, industry and community relations, program support and resources, and program assessment. To learn more about the standards, visit FDA's webpage shown on the bottom of the screen. Now hear from your peers in other local health departments about what the retail program standards mean to them and why they chose to enroll.
For us, it at least gave us a roadmap of what, how to improve our program. So we started specifically on Standard 2 because we thought that would be the most beneficial place for our agency, especially when we do have staff turnover, that now we have a really good program in place.
The program standards provide a roadmap for us to establish our own goals within our division, especially our food and lodging division, so that we know when we accomplish something and we can move on. It allows us to focus on one thing at a time without trying to figure out how to combat, as someone said, the entire elephant at one time, one bite at a time.
The goal of the mentorship program is to match local health department practitioners experienced in applying the retail program standards with local health departments currently enrolled in the program standards and looking for guidance, tools and resources, and recommendations for making progress toward conformance with the standards. This opportunity will provide capacity building among the local health departments participating in the mentorship program. Participating local health departments will identify ways to improve their retail food protection programs and achieve conformance with one or more of the program standards. Mentors may also assist mentees in completing self-assessments, developing improvement plans, and preparing for a verification audit. The mentorship program outcome and impact includes improved LHD, local health department recognition of the value of the program standards, increase capacity within local departments to implement the program standards, promote wider application of effective risk factor intervention strategies, lead to innovations in program implementation and administration, and increase knowledge among NACCHO and FDA staff on the challenges and strengths of the program standards. Strengthen partnerships with peer local departments to help prevent foodborne illness and outbreaks. Now hear from your peers as they describe how they have benefited from their participation in the mentorship program.
I think it would be beneficial for other health departments to enroll in the program standards because it can provide a basis for them to evaluate their program, to see what their strengths and weaknesses are, and help to determine what areas they can improve in order to provide a better service to their customers, as well as to provide a better protection to the citizens of their areas.
We have decided to look at one standard a year, and we really dive into that standard, and we're not satisfied until we feel like we've completely met it and maybe even gone above and beyond. But we don't try and focus on anything else. We gear it towards that one standard per year.
Our mentorship participants have included city and county health departments from across the country. The purple push pins indicate mentee locations, and the green push pins indicates locations of the mentor local departments. This diagram presents an overview of the mentorship program structure. The mentorship program begins with a kickoff call for mentors to go over mentor expectations and questions. It is then followed by a kickoff call for all mentorship program participants. During the call, the participants are given an overview of the program, timeline, expectations, tips, and an opportunity to ask questions. Mentors and mentees are expected to work together on their work plans and to schedule and conduct site visits. A mid-project call for mentorship program participants is held to answer any questions, review expectations, and to share updates on their progress. At the end of the mentorship program, all participants are invited for an in-person meeting in DC to share lessons learned, challenges, experiences, and other retail food safety topics. At the end of the mentorship program, all participants are also expected to submit a final report. By participating in the mentorship program, NACCHO and FDA will provide the following: financial support to help local departments make progress with the retail program standards, guidance and technical support through peer network, NACCHO facilitation of meetings, webinars, and project conference calls, NACCHO technical assistance and guidance to mentors, tools and resources such as FDA's Retail Food Program Resource Desk, and travel stipends for mentor-mentee site visits and for the end of the year face-to-face meeting in DC. Now hear from your peers on lessons learned about their participation during the mentorship program.
Other lessons that you could take away from it is that even though you're doing something one way, you hear these other departments, it's okay to say, you know what, I like their idea better. You know, maybe I can incorporate that into mine. And I think the lesson is we're just not in this alone. Before, you really did feel like your department had to come up with everything, do everything. But now it's this NACCHO program, mentor-mentee program, it really opens up your eyes to everybody's trying to meet this. Let's work together and head in the same direction. So.
One lesson that we learned through the mentorship program is that in order for us to fully understand a standard, we have to be able to teach that standard to someone else, and we cannot provide good information to somebody else if we don't have that thorough understanding of it. And so by being able to explain it, it's helped us to understand the underlying intent and meaning better.
Now hear from your peers about how their communities benefited from their agency's participation and work on the retail program standards.
Well, I think that every community is going to benefit from any agency's participation, because your inspection safety programs are going to become even better, and so the community is going to benefit through better public health. We rewrote our foodborne illness protocol so that we now it's much more effective and it works better for our community. our community is better able to communicate those complaints to us now as a result of us doing the revamping of the foodborne illness complaint form that is submitted. So that has been a big benefit for us. And I mean, just in general, it's going to make your program so much better that there's just better public health there.
I think that it's definitely beneficial to have staff that has been standardized. So when issues do arise, we at least know that all of our staff are on the same page, and we feel confident with where they are as inspectors and the training that they've received, and that certainly should be beneficial for the facilities we regulate, because we're hopefully giving them more standardized inspections.
If you have any questions about the Retail Program Standards Mentorship Program, feel free to contact either Amy Chang or myself. We look forward to hearing from you.